In other health news this morning, May is Stroke Awareness Month, and joining us this morning is Dr. Khan with Spectrum Health Medical Group. Good morning, Dr. Khan.
Good morning.
We have the largest volume in the state, stroke center, is that correct? And maybe one of the largest in the country? I think top 20 at least.
Butterworth Hospital Spectrum Health System has the 14th largest volume of stroke patients in the country.
By volume, so that we have a lot of people coming through. What are the risk factors for stroke?
One of the most important risk factors is high blood pressure. So controlling your blood pressure is very important. Another risk factor is smoking. So people who smoke need to quit in order to avoid a stroke. Diabetes is also another important risk factor for causing a stroke. Other than that, in elderly, atrial fibrillation, which is a heart rhythm problem, is one of the major causes of stroke in the patients beyond the age of 65.
So high blood pressure and smoking, and in the elderly, heart arrhythmia. Can you describe what happens during a stroke? What exactly happens to the body?
So there are two types of stroke. Okay. One type of stroke is where blood vessels are blocked by a clot, usually formed within the blood vessel itself. Sometimes could be coming from the heart, sometimes could be coming from the blood vessels in the neck. So that is what we call the ischemic type of stroke, where the blood flow to a certain part of the brain is blocked, and that brain, if the blood flow is not restored, dies as a cause of that clot. The other type of stroke is where a small blood vessel, and sometimes in some cases a larger one, burst open and a lot of blood flows into that area, destroying the area of that brain. And that is what we call a hemorrhagic type of stroke. And in general terms, in layman's language, that's called the brain bleed type of stroke. The most common cause is the ischemic type, which I explained earlier, and that's about 85% of the patients get the ischemic type of stroke, where a blood vessel is blocked by a clot, and the hemorrhagic type is only around 15%.
I had heard of the first, but I hadn't heard of the latter, of the brain bleed. So if someone is having a stroke, there are telltale signs and there are symptoms that people can look for, and there's a simple word that you use, an acronym that you use to help people find out if someone is having a stroke or not. Can you explain that?
Yeah, so American Heart Association has been promoting FAST, which is F is for face, and by that they mean any kind of facial droop or facial asymmetry. A is for arm, which means arm weakness. S is for speech, which means any kind of speech problems, either inability to speak or having a little bit of difficulty in coming up words or names of common objects. And then time is, T is for time, which is to emphasize the point that whenever you have symptoms like these, you need to call 911 immediately and go to an emergency room.
So FAST is face, arms, strength? Speech,
yep.
And time. So how would you, if you felt someone maybe having a stroke, how would you test the face or the arms? I know there are certain things that you can actually do.
So if you have a suspicion that one of your relatives or your friend or your colleague is having a stroke, you would like to ask them to smile for you. Okay. You would like to check how strong they are by pulling and pushing on their arm. And then you would like to ask them to name a few objects and to engage them into conversation. That being said, I don't expect the common people to actually try to diagnose a stroke out in the community. If there is ever a suspicion for a stroke, I think the best thing to do is to call 911. It might be a false alarm, but you would like to be on the safe side of things and immediately call emergency services if ever there's a suspicion of stroke.
And a stroke, what you're telling me now makes it sound like this is something that could happen very gradually.
Some patients do have some symptoms which come on slowly and then get worse, while there is a group of patients who can have sudden loss of strength, sudden loss of speech, sudden loss of vision. So there are two different ways people can progress in terms of a stroke.
Okay. And once they get to the hospital, what happens from there?
So usually if patients do call 911 immediately after the onset of their symptoms and they come to the hospital, And if it is not a bleeding type of stroke, which I explained earlier, then we have medications, clot-busting medications, which we can use to restore blood flow to the brain. Now, recently, in the last decade or so, we also have developed some special devices which we can use with the help of a catheter, which could go up into the blood vessel where the clot is, grab the clot through a specialized mechanism, and actually bring the clot out itself.
That's amazing.
Yeah, in the last 2 years, the efficacy of this kind of treatment has been proven in multiple clinical studies. And nowadays, we combine both of them. If you show up within the 4.5 hour of your onset of symptoms. And if you're beyond the 4.5 hour of your symptoms, then we're not able to give you the clot-busting medication, but we can still use these devices to take the clot out.
And that technology right here in West Michigan?
The technology is right here in West Michigan at Spectrum Health, Butterworth Hospital.
Thank you, Dr. Khan. Appreciate the time.
Thank you.
Thank you. Of course, Dr. Khan's office is located at 25 Michigan Street Northeast, Suite 6100, right here in Grand Rapids. You can call 616-267-7900 or visit online at shmg.org/stroke.